All right, so you have a patient and you have a concern for mono. What sort of history should you check for? Sexual history, i.e. kissing history. What's the best treatment for polycystic ovarian syndrome? Weight loss. Acute colonic ischemia is typically located in what sort of areas? Watershed areas. What's the most significant risk factor for colon cancer? Alcohol use. OCPs increase the risk of stroke, coronary artery disease, breast cancer, and what? VTEs for sure. Time to event data analyzed in survival analysis used to assess mortality benefit in prospective studies and clinical trials. Is that true or false? That is true. Central retinal artery occlusion. Should you be able to recognize that immediately if you're given an image? Definitely should. Can you imagine it? Yep, good. If a drunk patient needs a surgical intervention, what do you want to do? Chemically sedate them and perform it. Also, if it's a minor and they need major surgical intervention, do that as well. Note that many kids have ADHD as teens and benefit from treatment. Stimulants are good to treat ADHD and associated with increased risk of subacute substance abuse, by the way. Alright, not associated with increased risk of substance abuse. Stimulants are good to treat ADHD and are not associated with increased risk of substance abuse. Dementia and subacute combined degeneration are typically due to what? Deficiency. Vitamin B12 deficiency, right? And note that vitamin B12 deficiency can have mild indirect hyperbilirubinemia, secondary to ineffective erythropoiesis. Biguanide metformin is useful in diabetes mellitus with a NASH patient, by the way. For 14, your symptoms are likely secondary to uncoordinated smooth muscle contractions, and note that diltiazem may help to treat esophageal spasm. If a patient has a concern for Guillain-Barré syndrome, what sort of pulmonary test should you do? Measure the vital capacity. That would be smart to check for a diaphragmatic function. If a patient has Guillain-Barré syndrome, what sort of intervention may be helpful? A therapeutic plasma exchange would be super beneficial in someone with GBS. Weakness secondary to GBS may improve spontaneously, but what sort of intervention will help it improve faster? Right, treatment like IVIG or whatever. As of late, this is controversial. Children of gay and lesbian parents show no proven differences in development. Okay. Normal fasting blood glucose is between what level? 70 to 100 milligrams per deciliter. If it's less than that, it's like 60 milligrams per deciliter, it is likely hypoglycemia. Note that neutral protamine hagedorn is an intermediate acting insulin that peaks in 4 to 6 hours. Note that a 1.5 millimeter ST elevation in leads 1 in AVL with 1 millimeter ST depression in 2-3 in AVF is associated with what? STEMI type 1, right? Right. Malabsorption and abdominal pain. If you see that, you should be concerned for chronic pancreatitis. So perhaps order a magnetic resonance cholangiopancreatography. For 23, chronic pancreatitis recs are what? No alcohol, eat right, frequent small, low-fat meals, and no tobacco, and follow up in like 1 to 2 months, all right? If a patient is 30 plus years old and you have a palpable mass that you found, what should they do? A mammography, of course, right? Definitely. If you have a concern for Cushing syndrome, what do you want to get? A CT scan of the adrenals, right? People in contact with respiratory secretions of patients with meningococcal meningitis should receive antibiotic prophylaxis. Is that true or false? Oh, that's 100p true. 100%, by the way. Do patients associated with patients with meningococcal meningitis need anything? Yeah, they need prophylaxis with rifampin. If you have a patient and you suspect Duchenne's muscular dystrophy, what should you get? Get a creatine kinase level. If you have a patient with diabetes mellitus and the patient has concerns of sensation in distal extremities, what sort of test should you do? A tuning fork test, right? Note that diabetes mellitus patients with pain or tricyclic antidepressants or duloxetine or gabapentin or pregabalin, which one of those will may help? Either one, right? That's how you treat pain. Tricyclic antidepressants, duloxetine, gabapentin, or pregabalin. The standardized mortality ratio equals what? Well, you can call it SMR, and that equals the number of deaths in the observed divided by the number of deaths that are expected. Okay. Pelvic organ prolapse can be treated with what sort of placement? With a pessary placement and surgery. For 33, dysuria, if you see that or suspect it, chronic prostatitis should be on the differential, and you should get what two diagnostic things? Get a urinalysis and a culture, right? If you have a patient and they have more than 20 leukocytes in their high power field in the UA after a prostate massage, what should be on the differential? Chronic prostatitis, aka chronic pelvic pain syndrome. For chronic prostatitis, aka chronic pelvic pain syndrome, medications used for prostate enlargement like what may help? Alpha blockers. Long-term treatment for a kid with constipation includes what? Oral osmotic laxatives, right? You should use IV fluids and desmopressin in a dead person to do what? Keep their organs perfused so that transplantation, organ harvesting can occur, right? How do you treat keloids? With intralesional glucocorticoids. What is a complication of a keloid? Well, recurrences. If a person in cardiac arrest is down on the floor in front of you, what should you do? CPR immediately, and you want to make sure you start with those chest compressions. All right? Adios.